The connection between GLP-1 receptor agonists like semaglutide and Wegovy and cancer has been carefully studied, and the overall picture is more reassuring now than it was a few years ago.
Early on, there was worry about pancreatic cancer, but recent large-scale reviews by both US and European regulators found no solid evidence linking these medications to that risk. In fact, a big study comparing them to insulin showed that GLP-1 drugs may actually lower the risk of pancreatic cancer. Thyroid cancer has also been a concern, especially because animal studies showed that rodents developed certain thyroid tumors when exposed to these medications. But it turns out that the thyroid cells in humans and rodents respond differently. Human thyroid cells don't have the same receptors as rodent cells, making the findings less relevant. That said, experts still recommend avoiding GLP-1 drugs in people who have a personal or family history of medullary thyroid cancer or a rare condition called multiple endocrine neoplasia type 2.
As for other types of cancer, the news is generally positive.
A number of large studies and reviews have found no overall increase in cancer risk with GLP-1 medications. In fact, some reports suggest that these drugs might help protect against certain cancers that are more common in people with obesity, like liver, gallbladder, and possibly colon cancer. However, there have been a few studies pointing to a possible increase in colorectal cancer risk, so that area is still being closely monitored. These findings mean that for most people, GLP-1 receptor agonists are not only safe from a cancer standpoint, but might also offer some protection against cancers tied to weight and metabolic health. Still, it's important for patients and doctors to consider personal medical history when deciding on treatment, especially if there's a background of thyroid cancer or other high-risk conditions.
In summary, concerns about cancer has been looked at in depth, and the current evidence supports the safe use of GLP-1 medications for most people.
Ongoing studies and careful patient monitoring will help keep things up to date. Would you like help understanding whether this applies to a medication you're taking or considering?